So welcome everyone to meeting number 7 of the House of Commons Standing Committee on Health. The committee is meeting again today to discuss the Supplementary Estimates B for 2020-2021. I want to thank the witness for appearing again today. We have as witnesses, we have the Honorable Patty Hajdu, Minister of Health. We have from the Department of Health, Deputy Minister Stephen Lucas, and we have Les Linklater, Federal Lead, COVID Testing, Contact Tracing, and Data Management Strategies. With the Public Health Agency of Canada, we have Dr. Teresa Tam, Chief Public Health Officer, Ian Stewart, President, and from the Canadian Food Inspection Agency, we have Dr. Sidika Methani, President. From the Canadian Institutes of Health Research, Dr. Michael Strong, President. Today's meeting is taking place in a hybrid format. I would like to start the meeting by providing you with some information following the motion that was adopted in the House on Wednesday, September 23rd, 2020. As a committee, the committee is now sitting in a hybrid format, meaning that members can participate either in person or by video conference. All members, regardless of their method of participation, will be counted for the purpose of quorum. The committee's power to sit is, however, limited by the priority use of House resources, which is determined by the whips. All questions must be decided by recorded vote, unless the committee disposes of them with unanimous consent or on division. And finally, the committee may deliberate in camera, providing that it takes into account the potential risks to confidentiality inherent to such deliberations with remote participants. The proceedings will be made available via the House of Commons website, and so you are aware that webcast will always show the person speaking rather than the entirety of the committee. To ensure an orderly meeting, I'd like to outline a few rules to follow. For those participating virtually, members and witnesses may speak in the official language of their choice. Interpretation services are available for this meeting. You have the choice at the bottom of your screen of either Floor, English, or French. Before speaking, click on the microphone icon to activate your own mic. When you're done speaking, please put your mic on mute to minimize any interference. A reminder that all comments by members and witnesses should be addressed through the chair. Should members need to request the floor outside of their designated time for questions, they should activate their mic and state that they have a point of order. If a member wishes to intervene on a point of order that has been raised by another member, they should use the raised hand function. This will signal to the chair your interest to speak and create a speakers list. And in order to do so, you should click on participants at the bottom of the screen. When the list pops up, you will see next to your name that you can click raise hand. When speaking, please speak slowly and clearly. Unless there are exceptional circumstances, the use of headsets with a boom microphone is mandatory for everyone participating remotely. Should any technical challenges arrive, please advise the chair or the clerk. Please note that we may need to suspend a few minutes as we need to ensure that all members are able to participate fully. For those participating in person, we proceed as you usually would when the whole committee is meeting in person in a committee room. Keep in mind the directives from the Board of Internal Economy regarding masking and health protocols. Should you wish to get my attention, signal me with a hand gesture or at an appropriate time, call my name. Should you wish to raise a point of order, wait for an appropriate time and indicate to me clearly that you wish to raise a point of order. With regard to a speaking list, the committee clerk and I will do the best we can to maintain a consolidated order of speaking for all members, whether they are participating virtually or in person. In order to be fair for all committee members, this list of speakers will only be activated once the meeting has officially started and not upon admission to the room. Having said that, gone through the housekeeping, I would invite the Honorable Patty Hajdu, Minister, to make an opening statement. 10 minutes, please, Minister.
Thank you very much, Mr. Chair, and I thank all the members for inviting me to appear before the HESA committee. And I will just reiterate that I have a number of departmental officials joining me today, including Dr. Stephen Lucas, who's the Deputy Minister of Health Canada, Ian Stewart, who is the President of the Public Health Agency of Canada, Dr. Teresa Tam, Canada's Chief Public Health Officer, Dr. Mike Strong, who is the President of CIHR, Les Linklater, who is the Federal Lead for COVID-19 Testing, Contact Tracing, and Data Management Strategies, and Dr. Sidika Methani, President of CFIA. As per the request of interpretation, I'll keep my remarks in one language so that translation is easier for them. I want to start at the beginning and reflect on how the COVID-19 pandemic has shaped and continues to shape our work. Right now, we are seeing a troubling trend of resurgence in Canada. Cases of COVID-19 in our communities are rising at a concerning rate, one that is higher than it was during the spring peak. But Canada is better prepared. We have more secure procurement of personal protective equipment. We have a higher testing capacity across the country. And we have a better understanding of the virus, thanks in a great part to investments in research and science. And we have a better understanding of how to treat COVID-19. So these things are helping to keep Canadians safer across the country during the second wave. Because this is a new virus, we've made significant investments in Canadian research, which has improved our understanding of COVID-19 and its impacts on Canadians and indeed for the international community. And we've all learned that the path through this pandemic is anything but predictable or straightforward. As we face a long winter, we continue to ask Canadians to follow public health guidelines so that we can get this virus under control, avoid further loss of life, prevent more economic hardship, and buy us the time that we need until we have a safe and viable vaccine here on our shores. This will continue to be our top priority in the months to come, both for our government and for my portfolio. Mr. Chair, you will recall that the recent speech from the throne responds directly to the challenges posed by the pandemic. It also confirms my department's role at the center of the response. I have to thank the hardworking people of Health Canada and the Public Health Agency of Canada who have worked diligently to help the provinces and territories to increase their testing capacity, their ability to do and perform contact tracing, and to suppress outbreaks. That work includes ensuring access to personal protective equipment, both by building our domestic capacity and by securing our supply chains. And the work includes developing and deploying a vaccine strategy to ensure that we're ready when one is available. But the health response to COVID-19 is only part of the story. The pandemic has exposed a number of gaps in Canada's social systems, which we referred to in the speech from the throne. Again, my department continues to do important work to address these gaps and to support the provinces and territories in their role and responsibility to administer health care. The pandemic has highlighted systemic problems in long-term care. As many Canadians and many of my colleagues here today have advocated for, we are committed to working with the provinces and territories to set standards for long-term care for seniors who reside in long-term care homes. We are also working to improve access to family doctors and primary care teams, especially in rural and remote communities. And we've been working with provinces and territories to improve access to virtual healthcare, a service that has proven essential to Canadians during the pandemic. 530,000 Canadians have accessed, for example, the mental wellness portal to chat, text, or meet over video with professionals. And we'll continue to address the opioid overdose crisis, which has worsened during the pandemic. It is essential that Canadians are able to access mental health and substance use supports that they need during this time. Finally, we will continue to take action and indeed accelerate action towards a national universal pharmacare program. These priorities reflect a great deal of work that is already underway in the health portfolio. As we move into the fall and winter, we will tackle each of these issues with increased focus and vigor. As the pandemic has evolved, so has our response, and our budgetary needs reflect this. Throughout the health portfolio, we are seeking additional authorities for a variety of purposes related to COVID-19. Medical research, federal investments through the Safe Restart Agreement, drugs, medical devices, and virtual care, along with many other initiatives to help Canadians through these uncertain times. Mr. Chair, our government has taken swift, coordinated, and unprecedented actions to protect the health and well-being of Canadians, to keep businesses afloat, support Canadians through difficult times, and keep our economy running. And in true Canadian fashion, Canadians have stepped up. They have listened to public health advice. They have made sacrifices and they've shown resilience. However, we are not out of the woods just yet, and we cannot forget that this virus remains a threat to all of us and that we need to stay vigilant. With infection rates climbing across the country, we all must do more together. The world is working feverishly towards a long-term solution to defeat COVID-19. Until we reach that point, we must continue to persevere and to support each other, because together we will get through this. Thank you, Mr. Chair.
At this point, start our 6-minute round with Ms. Rempel-Garner. Please go ahead, 6 minutes.
It's actually Mr. D'Entremont.
Okay, I apologize. Mr. D'Entremont, please go ahead, 6 minutes.
Thank you very much, Mr. Chair and Minister and staff. Thank you so much for being with us today. And I want to go to something that really you didn't really have in the speech, which is the issue that's probably giving people the most hope for a better year coming up, which is the issue of vaccines. So we've asked a number of times, and we haven't necessarily got a clear answer on when you expect vaccines to be delivered to Canada.
Well, thank you very much for the question, and through the chair, I'll just say you're absolutely right. The arrival of vaccines is the glimmer of hope that Canadians are looking towards to provide some alleviation of the challenges that we're all having around the world with COVID-19. And in fact, I'm so proud of Canada for the work that we've done to procure vaccines through the expert advice of the Vaccine Task Force. In fact, we have procured more vaccines per capita than any other country in the world. And 2 of the 7 candidates, as you know, have shown very promising results so far and have actually applied to Health Canada for a rolling regulatory review. We anticipate getting some doses, hopefully in Q1, certainly of 2021, but certainly that work is ongoing, and there are a number of steps underway before we actually can begin to vaccinate Canadians. We're taking those steps and we're working very closely with the manufacturers, indeed with the provinces and territories, to ensure that we have a vaccine strategy plan underway and that we can deploy those vaccines when they become approved.
When Q1 is a long period of time. I mean, it could happen early January, could happen, of course, in March. Do you have a better timeline, maybe, that you might be coming up with at some point in the very near future on what that rollout is going to look like? Which vaccines are going to be coming to us? Which ones are showing the most promise? Those kinds of pieces of information.
Thank you very much. And through the chair, we do have obviously 2 vaccines that are showing the most promise. That is the Pfizer vaccine and the Moderna vaccine, both of which Canada has purchased millions of doses, and both who have applied to Health Canada for a rolling regulatory approval. This is exciting news. The regulatory approval has been, as you know, accelerated to make sure that we can review data as the manufacturers provide that data, so that we don't have to wait till the conclusion of the clinical trials. All of that is good news. Of course, it would be irresponsible for me to give you a precise date, because much of that depends on the manufacturer's process, the regulatory review process, but certainly we're optimistic that we should be able to see doses in Q1, and we'll be working really hard with the manufacturers to hopefully see that success.
All right. So let's say FDA in the States actually approves something. How quickly could Canada approve something? So because we're inundated with information coming from the U.S. Of course, we're going to find out when they get theirs approved. When can we expect ours to get approved? Is our process that much longer?
You know, I can't comment on the American process. I don't know what the American process is. I will just say the Canadian process is focused on 2 things. First of all, the safety of the vaccines, and that is obviously what every Canadian expects, that the regulators will do their due diligence to ensure that the vaccines are safe and that they're effective as per the manufacturer's claims. We have doubled the capacity, if not more, of the regulatory department. We have teams teams of regulators for each vaccine ready to review that data, and in fact are reviewing a lot of the data already. As I said, these rolling reviews allow for regulators to review data as it arrives, as opposed to having it all at the conclusion of the clinical trials. So we're well positioned to be working with the manufacturer to review the data as they produce it.
All right. So we were hoping quarter 1. That is kind of where we're getting at this point. So while we're waiting for quarter 1, have you developed national guidelines surrounding who will get the vaccines first, as has been done in other countries?
Thank you. And through the chair, yes, the National Advisory Council on Immunization, which is an independent body that provides advice to the Public Health Agency of Canada, has provided interim guidance based on very general information that we have right now about the vaccines and who they would be indicated for use with. Certainly, provinces and territories also, in some cases, have their own advisors around priority populations, and that work is underway.
Can you table that with the committee?
I believe that the guidance from NACI is public. I'll turn to my officials to see.
Yes, indeed, it is public. The interim guidance was released on November 3rd, and we can provide that to the committee through the chair.
Okay. Have you developed a national strategy for how and where the vaccine will be deployed? Because we're having provinces now that seem to be getting a little ahead of the federal guidelines, or at least the federal rules. So where are those things going to be going?
So each vaccine has its own unique properties and its own unique logistics related to how it's transported, how it's stored, and how it's deployed. And yes, we're working through those strategies now, both on a federal level, but also with provinces and territories to ensure that their plans scope in the requirements for the vaccines as we understand them now, and also that they have the capacity to appropriately distribute it or store the vaccines. That work is underway right now.
Thank you, Mr. D'Entremont. We go now to Mr. Kilroy. Mr. Kilroy, please go ahead. You have 6 minutes.
Thank you, Mr. Chair, and thank you for joining us today, Minister. And I want to extend a heartfelt thank you to you and the officials here with us today for your hard work protecting Canadians since the onset of this pandemic. So as you know, and as many know, the J.A. Douglas McCurdy Airport in my riding has suffered greatly due to the COVID-19 pandemic. Many have. While the Atlantic bubble has kept those of us in the Atlantic provinces safe, my constituents and many Canadians are looking for innovative solutions to the challenges airports in the Atlantic are facing because of the 2-week isolation period caused by the pandemic. And it's undeniable that international travel and mobility during the pandemic has contributed to the spread of COVID-19 in Canada. But we also know that these measures are causing a strain on Canadians. Could you tell us about the strategies the government is looking to potentially reduce isolation periods for travelers entering Canada or Canadians entering the Atlantic bubble without compromising the health and the safety of Canadians?
Well, thank you very much. And through the chair, that's an excellent question. And I know that the 14-day quarantine, while protecting Canadians, also presents some real challenges for people, interprovincial travel being one of them in the case of the Atlantic bubble, but also travel across international borders, including the United States. The 14-day quarantine, although difficult, has been an important tool, though, to reduce the importation of virus into Canada and, of course, into regions that have very low transmission. And that is why we continue to enforce those border measures in Canada and especially at the international borders. We believe that the changes to that need to be grounded in evidence and in research. And that's why we've been working closely with Alberta on the feasibility of using a rigorous testing and monitoring program that combines testing and some limited isolation to understand how we could reduce that mandatory quarantine system in a safe way. And so I'm very pleased that the Calgary International Airport and Coutts Land border are the location of this pilot. I will also say the work of Air Canada and WestJet in private partnerships with universities will provide additional evidence. And I think that evidence will give Canada some very strong scientific basis to move forward on how we alleviate mandatory quarantine length.
Thank you, Minister. I want to pivot just a bit on vaccines and lots of talk about it. We've had a question here today about it. So a lot of exciting developments have started to come up, and we're starting to look a bit more optimistic about having a vaccine as soon perhaps as a couple of months. But we know the provinces and territories are responsible. They're responsible for delivering healthcare, but a COVID vaccine it's going to take a lot of logistical coordination and cooperation. So can you tell us a bit more about the work being done to ensure that vaccines will be developed quickly and safely when the time comes? And additionally, I've heard from provinces like Ontario and Alberta that they're expecting certain numbers of vaccines. And I work with a lot of vulnerable groups, Minister, in my riding, and I'm wondering if this is also true for Indigenous populations and other federally supported groups.
Thank you very much through the chair for the question. And I think it's such you're right, it's such exciting news, I think, for the world that there are vaccines that are starting to demonstrate high degrees of effectiveness. Of course, early days still, but I have to say we have one of the strongest vaccine portfolios in the world. And again, the Vaccine Task Force has been guiding our way. And I do want to point out that the members of the task force are volunteers on top of that. They come from all kinds of diverse backgrounds that might include virology, the business sector, and indeed experts in the pharmaceutical sector. And I think that blend of expertise has really been helpful for Canada. We have been working, as you know, closely with provincial and territorial partners on the issue of vaccines and how we will deploy them. Some of the vaccines have very challenging logistical considerations, and we'll be supporting provinces and territories to make sure that they have in place what they need to store these vaccines and transport them safely. In terms of the doses, and I know provinces are excited to get doses and talk about numbers, those numbers are still, we're still in discussions right now with the provinces and territories about how we'll share the doses as they arrive. It's very important that we do this together because, of course, we want it to be fair, we want it to be equitable, and of course, we've done this before with things like personal protective equipment and rapid tests, and I have every confidence that with provinces and territories, we'll work on an agreement that ensures that we can protect Canadians and also the federal government can protect the populations to which we have a responsibility.
Thank you, Minister. Those are my questions for now, Chair.
Thank you, Mr. Kilroy. We go now to Monsieur Thériault. Désolé. Monsieur Samary pour Monsieur Thériault. Allez-y, 6 minutes, s'il vous plaît.
Oui, merci, Monsieur.
Thank you, Chair. First, I'd like to say hello to all of you and pay tribute to all of you and the support team and the interpreters who are in the room here. And I would like to say a special hello to Madam Minister, Dr. Tam, and all of our invited guests. Thank you all for being here today. My questions will be for our Minister. I would like to begin with this question, Minister. According to an article in the Devoir written by Hélène Bouzati, she quoted Dr. Tam's assistant, Dr. Howard Njo. I'm sorry if I didn't pronounce his name correctly. And he says, the provincial authorities are the ones who know the best what their reality is in Quebec. So I'd like to ask the Minister if she agrees, generally speaking, with that statement.
Agree generally with that statement. I think it's important that we understand, especially in the consideration, for example, of public health measures that provinces, the provincial medical officers of health are often the closest to the ground. They understand their populations. They know oftentimes, how to blend action with messaging in a way that's most appropriate for the people that they serve.
Okay, ben merci.
Thank you for that answer. Now, related to this, and also the Minister, in your introductory speech, you referred to the speech from the throne. In the week before, now we're talking about last September 18th, we had the premiers of Quebec, Ontario, Alberta, and Manitoba who spoke on behalf of all provinces and territories. They asked for funding for health spending for the provinces. They asked for the federal government to increase from 22 to 35%. I would like to ask the Minister whether she agrees with this request, which was not in the speech from the throne.
Thank you very much through the chair for the question. And I'll just say, listen, we provided $19 billion to provinces and territories in May for their response to COVID-19, a large portion of that for healthcare responses, whether it was through personal protective equipment, whether it was to augment testing, contact tracing, data capabilities, an additional $740 million for long-term care homes to augment the support that we provided through the Canadian Red Cross and the military in the spring to help protect seniors in a more effective way through this second wave. We're going to continue to be there for provinces and territories. I know the Prime Minister has committed to a meeting on health transfers in the beginning of December, and I look forward to those discussions.
OK, je remercie la ministre pour sa réponse. Et est-ce qu'elle...
I'd like to thank the Minister for her answer. Could you give us the date of this meeting that is to be held in early December?
I'm sorry, I don't have the calendar of the Prime Minister. Thank you.
OK, merci. J'aurais essayé.
All right, thank you. I'll try again. The government is committed to transferring $19 billion to the provinces, of which 10 are for health-related spending, and that's in the undertakings. And I would like to ask, as of those 10 billion health dollars, how many have in fact been transferred to the provinces?
The allocation for Quebec is $3.1 billion of the total $19 billion.
Et c'est ça ma question est à savoir ce 3,1.
And my question is that $3.1 billion for Quebec, is that amount of money an amount that has already been paid to Quebec, and how much has already been transferred to Quebec as of today? Thank you.
Mr. Chair, I'll turn to an official if they have the answer.
The funds were transferred to the provinces and territories in September this year.
Oh, ben c'est merci.
Thank you to the official for this answer. It's most encouraging. Provincial governments have been requesting an increase in health transfer payments, and that this be unconditional, not only for the current pandemic, but also on a recurring basis. We know that we have an aging population. We've seen the consequences in long-term care homes for seniors particularly. And we saw what consequences all of this brought as a result of the underfunding. I'd like to ask the minister whether she believes that the federal government should give more support in a more recurring fashion to provincial health spending. Thank you.
Thank you. And through the chair, I believe that the federal government has demonstrated strong partnership with provinces and territories in the form of federal health spending, not only in the $19 billion of safe restart agreements, but also in the procurement and deployment of the rapid tests, in the procurement of the vaccines. The federal government has been there for provinces and territories throughout the pandemic, both financially and practically, and we will continue to do that.
Je remercie la ministre pour sa réponse. Et
I thank the minister for her reply. My question was on health transfers. As I remind you, Ottawa was covering half of spending originally, and at the end of at the late 1960s, that was it. In the 1980s, we were still talking about roughly 40% of spending. And now it stands at 22%. Provinces and Quebec and the other provinces are asking for an equivalent of a third or a bit more, 35%. So my question was bearing on this. I would like to know whether the minister believes that the government should increase the share of provincial health spending.
Thank you very much. And through the chair, listen, I think, again, the federal government has demonstrated a willingness to support provinces and territories through additional health spending, through the contributions, as I mentioned, of the $19 billion through Safe Restart. That doesn't include other kinds of dollars of transfers. For example, the $2 billion for Safer Schools that was made at the beginning of September to support safer and healthier schools will continue to be there for provinces and territories, Mr. Chair, as we have throughout the pandemic.
Merci, Monsieur Samari.
merci, Monsieur le Président. Merci, Madame.
Thank you, Mr. Samos. Thank you, Chair, and thank you, Madam Minister.
We go now to Mr. Davies. Mr. Davies, please go ahead. 6 minutes.
Thank you, Mr. Chair, and thank you to the Minister and the officials for being with us. I know we may disagree on certain policies and be critical at times, but I want to take a moment and thank you, Minister. I know that being the lead minister at a time of a global pandemic is not easy, so I thank you for your service to all of us. Minister, first, if I could direct you to vaccines, the U.S. Center for Disease Control has released a vaccine distribution strategy which sets a target date of November 15th for states to be ready for COVID-19 vaccine distribution. Does Canada have a target readiness date for vaccine distribution? And if so, what is that date?
Thank you very much, and thanks for your thanks through the chair for the members' kind words and support. I agree. This is a Team Canada moment and a time where we all need to pull together despite our political differences. And I'll just say, in terms of the vaccine strategy and the vaccine readiness, we're working now with provinces and territories very diligently to make sure that we have a robust federal and provincial plan in place. Provinces and territories are submitting their plans. We're going through them together to make sure that we haven't overlooked any of the aspects of the logistics and the delivery and the plan, and we'll continue that hard work together.
Okay, I'm sorry, I don't hear a date there. I'm going to assume that we don't yet have a date fixed yet. Is that correct?
As I said, we are working very diligently with provinces and territories right now. The plan is being developed.
Okay, thank you. And the U.S. Center for Disease Control has also established that once a vaccine has been approved, U.S. authorities have a plan to begin distribution within 24 hours. Does Canada have a similar plan to distribute this vaccine within 24 hours if and when a vaccine is approved?
The focus for the work that we're doing together with provinces and territories right now is to make sure that we have expedited review capacity to support the as I said, rolling regulatory review of the vaccines as they come in, so that we can rapidly approve them when we have data that demonstrates the vaccines are safe and effective. And secondly, to make sure that provinces, territories, and indeed the federal government are well positioned to get the vaccine around the country and deploy it in a safe, effective, and fair way.
Thank you. Now, Minister, I know you know that this week the Ontario Health Minister this week came out publicly and stated very categorically that Ontario was going to be, or announced that they knew that Canada was going to be receiving some 6 million doses of vaccine, 4 million from Pfizer, 2 million from Moderna. She even broke down how many of those doses would be for Ontario. She said 1.6 million of the 4 million from Pfizer would go to Ontario, and 800,000 doses from the 2 million from Moderna would go to Ontario. Minister, those are very concrete numbers. Is she making those numbers up?
Thanks, and through the chair, as I've said, the work to determine the distribution of the available doses is ongoing. Provinces and territories know that we have a collaborative process whereby we discuss and agree on a distribution formula that works for everyone, and we'll continue that work. I think it is premature for provinces and territories at this point to be stating doses that they may receive, because of course those conversations continue.
Okay. Now, I know that certain drug manufacturers like AstraZeneca have given countries like Brazil, Japan, Australia, and India the ability to manufacture the vaccine themselves. And this, of course, will speed up vaccine manufacturing and also help secure access to any vaccine to their citizens. Has Canada negotiated this same right with AstraZeneca to produce the vaccine ourselves in Canada?
I will turn to my officials to talk about the various aspects of the AstraZeneca vaccine. Perhaps Stephen Lucas.
Thank you, Minister. I will indicate we have received the regulatory submission from AstraZeneca based on obtaining it from a manufacturing site outside of Canada. I'll turn to Ian Stewart, President of the Public Health Agency, to provide a few more words in terms of the approach. Ian?
So far, Canadian domestic manufacturing capacity has been focused on Canadian vaccine development, companies like VBI, for instance, as opposed to international companies.
Could I follow up, Mr. Stewart? Of the promising vaccines from Pfizer or Moderna or AstraZeneca, has Canada negotiated the right to manufacture those vaccines here if any of those vaccines are approved by Health Canada?
Our relationships with them is to procure their vaccines and have them manufacture and deliver them to us. They have not asked us to manufacture vaccines for them.
Okay. We know that we're going through the flu vaccine season, and there's been shortages of flu vaccine around the country. I'm just wondering who is going to be doing the vaccinations, hopefully if and when we are soon going to be proceeding with that. Presumably we'll have tens of millions of Canadians lining up for a COVID vaccine. Is that going to be done through the nation's pharmacies? Who's coordinating that, and who will be doing the vaccinations?
Well, thank you very much. And through the chair, delivery of the vaccines will rest largely with provinces and territories in terms of vaccinating Canadians. It is their primary responsibility to deliver healthcare, including vaccination programs. The federal government is procuring the vaccines and in some cases distributing vaccines to agreed upon centers in the provinces and territories. But the administration of the vaccine to Canadians will be largely done by provincial partners.
Thank you, Mr. Davies.
Thank you. That
ends our 6-minute round. We start our second round with Mr. Barlow, I believe, 5 minutes.
Actually, Chair, it's actually me. We just switched the top two.
I see. Okay. Well, go ahead, Ms. Rempel-Garner, 5 minutes, please.
Thank you, Chair. To either the Deputy Minister or the President, the Minister mentioned that some doses of the vaccine would arrive in Q1. How many?
Under our existing agreements, we expect to be receiving 6 million doses by March 31st.
So that's a pretty quick timeline. Just to my colleague, Mr. Davies' questions, when will you be giving what date are you telling the provinces to be ready to administer the vaccine by?
There's a lot of uncertainty about when vaccines will actually be ready. We have contracts that request vaccines by March 31st, but they have to be approved for use in Canada. And that regulatory decision has yet to be taken.
So just to clarify then, so when the minister says that some doses may arrive, there's 6 million doses that may arrive by the end of March, but we're not sure if the regulatory approval will be done by then. Is that correct?
There is 6 million doses contracted to arrive by March 31st. And in order to use those doses, we need to have them approved by the regulator, yes.
Do you have a sense on whether or not that would be done by the time of their arrival?
I'll turn to my colleague, Steve Lucas. He's the regulator at Health Canada.
And Mr. Chair, I would indicate we have, for both Pfizer and Moderna, received their rolling submissions near the beginning of October. And as Minister Hajdu had indicated, have been reviewing that information, and upon the completion of information provided by the manufacturer, Health Canada will render its regulatory decisions as quickly as possible.
Do you think that that will happen before or after March 31st?
We are working very diligently with the information provided, and we will complete as quickly as possible our regulatory review following the final provision of information from the manufacturer as required by the interim order and rolling review process.
So have you given to either of the men I just mentioned, have you given the provinces any sort of target date for readiness within that timeline?
As the minister indicated, we're in a long and deep discussion with the provinces around preparing and in order for them to be ready, Mr. Chair.
Ms. Rempel-Garner, please let the witnesses answer.
I only have 3 minutes. Thank you. So just to build on my colleague, Mr. Davies' questions, the Alberta Minister of Health, Tyler Shandro, tweeted out about a day ago that they would be slated to receive 465,000 doses of this vaccine in the first quarter of 2021. Mr. Lucas, is he wrong?
Mr. Chair, I believe.
Sorry, Mr. Stewart.
Sorry, okay. As I was mentioning in response to your previous question, we have a discussion going on with the provinces around how we do the rollout. And in order to have a discussion, we have to have discussions about the number of doses that would be available, and that's the 6 million figure. And then I think that different provinces are working out in order to prepare and do their preparations, what they take to be a rough estimate of what they expect to receive. As the minister indicated,
so they're just
discussions about the allocations, Mr. Chair, have not yet been completed. And those discussions are ongoing at this time.
So, Mr. Stewart, they tweeted out or announced information that was incorrect in your opinion?
I think until the allocations settle out, it's hard to know whether their estimation is correct or not.
Okay. Are provinces going to be receiving allocations on a per capita basis or other criteria?
The minister mentioned in her remarks that we have had a number of instances where we do provide material out to the provinces. You'll remember testing and personal protective equipment as examples. In those instances, usually it was a mix of per capita and some other considerations, but we're not there yet. Those discussions are still underway.
When will the other criteria be ready?
Which other criteria? You mean the other considerations in addition to per capita? Well, that's part of the current discussion underway.
When will that be ready for us to evaluate?
I don't know that I can speak to when this would be brought to this committee.
Sorry, I'll ask it a different way. When will those considerations be completed?
We're having those discussions with the provinces now, and they're progressing very well. It's a very constructive discussion, so we're hopeful in the near term.
Thank you, Ms. Garner. Thank you, Ms. Garner. We go now to Dr. Pawlowski. Dr. Pawlowski, 5 minutes, please.
I too wanted to talk about the vaccines. It seems like we did pretty well. We have both of the vaccines which seem to be effective are in our portfolio. I would note we've ordered 20 million doses of Pfizer and 56 million doses of Moderna. And given it takes 2 doses of each to vaccinate somebody, I calculate that as we've ordered 38 million doses, and given our population is 35 million, I think somebody did really well there. The Conservatives may have broken clocks, even right twice a day, but we Liberals know that it was our natural brilliance. someone made a pretty good call there. But I had a couple of questions about the vaccine and the authorization process. So these vaccines haven't been authorized yet. Now, every country in the world's in the same boat on this. Certainly, there's the FDA in the United States. There's the United Kingdom regulators. There's the EU. We're all looking at the same data, making decisions on authorization and coming to a conclusion as to whether or not to authorize it. Is this made in conjunction with other comparable agencies around the world? Will this, as I would think it should, lead to an expedited conclusion and approval process? And maybe can I, because I want to get my second question in. That's the first question. Now, this may be part of contract details that our government does not want to reveal, but there's obviously a lot of countries that want to get these vaccines as soon as possible. Are there details in the contract or an agreement with the companies as to an order by which countries will receive the doses? Or is it purely based on a contractual basis that you've agreed so many vaccines by so many days? Or is it according to countries, and certain countries like the United States can get hold of the first doses? So, and that question's to anyone.
Okay, well, I'll start, thanks, through the chair, and then I'll turn to the officials to speak a little bit more about the review process in detail. But I'll just say, first of all, the member's right. There's 56 million doses of Moderna that we have that we have purchased and 20 million doses of Pfizer, and that sets us up well in terms of our capacity with these two promising vaccines. I'll also point out that the vaccine candidate, there are 5 others that we also have millions of doses procured, and AstraZeneca being one of them. And so, again, the Vaccine Task Force has served us so well in terms of guiding us towards very promising vaccines and really placing our bets, if you will, on the right horses, so to speak, in the vaccine world. In terms of the contractual obligations, that's probably a better question for the Minister of Procurement. Certainly, I know that the contracts are extensive and complex, and I would prefer to let her answer questions around details of contracts that she may know and may know which aspects are confidential or not. But I will just say this: this has been a whole of government approach. I know that the Minister of Procurement has worked incredibly hard with all of the companies, in some cases with personal calls to the CEOs. I myself also have met, for example, to encourage them to have Canada at the top of the list. And that has served us well. Those personal relationships and that ongoing conversation with all of the pharmaceutical companies to make sure that they see Canada, they know that Canada matters, that even though we might be much smaller than our American counterpart, that we are an important player in this space. And so I think that served us well. In terms of the regulatory approval, I'll just say this. Obviously, it's very important to Canadians that we have a Canadian review. I know that we do consult with other regulators, but I will turn to Stephen Lucas to talk about the nature of those conversations.
Thank you, Mr. Chair. As Minister Hajdu indicated, we have a strong regulatory organization here and have significantly increased capacity for the reviews of vaccine candidates. We do cooperate internationally, both on a multilateral basis through the International Coalition of Medicines Regulatory Authorities, which has focused on vaccines and therapeutics associated with COVID, but as well work closely with a number of trusted regulatory partners, including the U.S. Food and Drug Administration, the European Medicines Agency, the United Kingdom, Switzerland, as well as Australia. And that work continues to enable us to learn from each other and have additional support and scientific evaluation to help us ensure that we have strong reviews and expedite the process.
Thank you, Dr. Pawlowski. We go now to, on my list, it says Mr. Dantemont. Mr. Dantemont, go ahead.
It's
5
Mr.
minutes.
Barlow.
I think
Chair.
Mr. Barlow's going. Yeah.
Okay, Mr. Barlow, please go ahead.
Thank you very much, Mr. Chair. Mr. Lucas, has your department done any estimates on how many rapid tests would be needed to test every traveler entering into Canada at all land and air crossings?
Mr. Chair, I will turn that question to Les Linklater, who's federal lead for testing.
Thank you for the question, Mr. Chair. As Minister Hajdu referenced earlier in her remarks, there is work that is ongoing with a number of partners to test the opportunities to use testing at the border. We have not at this point done comprehensive analysis around what would be required to scale up to travel levels that existed pre-pandemic, but we are working to look at options for the use of testing at the border to facilitate risk-based approaches to reopening.
So there's no rapid tests available or been approved at this point to meet those needs?
A number of rapid tests have been approved, most recently antigen tests in terms of deployment at the border. There are some discussions now with a number of airport authorities around the potential to move forward with pilot projects. And of course, we do have the use of PCR testing at the airports in Calgary and the land border at Coots to effectively test the flexibilities around quarantine.
Okay, Mr. Lucas or Mr. Linklater, whoever takes this question, on what day do you anticipate that all major Canadian airports will have access to safe rapid testing technologies, which will allow passengers to reduce or eliminate the 14-day quarantine period with proof of a negative test?
I think at this point, if I may, Mr. Chair, as the Minister referenced, we are very much focused on building our evidence base to make good decisions, positive decisions around safe reopening of Canada's borders. The pilots that are underway now will help provide additional data points for that. And we are looking to partner with others who may come forward with opportunities to pilot in that space. At this point, it would be premature to predict a date when large-scale testing would either be required or available at ports of entry.
Thank you. And I think it was Mr. Stewart had mentioned that most of our resources, let's say, in Canada have been focused on trying to find a Canadian developed vaccine. But Mr. Lucas, or again, Mr. Linklater, have you made any recommendations to the government on using rapid testing technology to reduce the 14-day quarantine? You know, for example, I know there's several companies, including ClearMe in Alberta, that have been approved, FDA approved, and are being used in other countries, but not here in Canada. Have you made any recommendations on rapid tests for to reduce that 14-day quarantine?
Mr. Chair, again, if I could, it's very important for the safety of the Canadian public that tests that are approved by the regulator are tests that are deployed in any way, shape, or form to support screening or testing needs in Canada. At this point, we do have a number of approved tests. Some are now available for provinces and territories and for the federal government to work with partners to assess the viability for different ways of using them to facilitate border travel.
Mr. Lucas, how many COVID-19 home test applications are being reviewed currently by Health Canada?
At this time, Health Canada does not have any home test applications.
Has your department made overtures to companies, for example, to submit COVID-19 tests for self-testing at home for approval by Health Canada?
Yes, we regularly contact companies, both Canadian entrepreneurs as well as international companies for a range of diagnostic tests, and that includes home tests.
Can you give me a number, Mr. Lucas, on how many companies have you reached out to and what the response has been?
I don't have the information with me, Mr. Chair, in terms of a specific number. These discussions are ongoing, and certainly that engagement has led to submissions of other types of tests to Canada, and will continue.
Mr. Lucas, have you made any recommendations to the government on speeding up the approval process on rapid tests in Canada?
The government has invested in our regulatory capacity to enable expedited reviews. The review process occurs under an interim order that allows for expedited reviews. We have set service standards to enable predictability for companies and work extensively with them through the review process to get the information required to render decisions as quickly as possible.
Thank you, Mr. Barlow.
Thank you very much, Mr. Chair.
Monsieur Samary, c'est à vous maintenant. 2 minutes et demi, s'il vous plaît.
Merci.
2.5 minutes. Thank you, Chair. My first question is for Dr. Tam. Dr. Tam, this is my question. As the Chief Medical Officer, if we go back to last winter, before the first wave of the pandemic began, from your point of view, do you believe that the public health system was suffering from underfunding? And did that underfunding make this public health system be more fragile? I'm thinking more specifically of long-term care homes. And if this is in fact the case, this underfunding, which increased the level of fragility, did this have an impact on public health's response to the pandemic?
Well, in terms of the health system and also even more complicated, the long-term care system, which is funded both privately and also publicly. This is actually in the purview of local and provincial jurisdictions. But as the Chief Public Health Officer, I've been pointing out some of the systemic issues that have been present in Canada prior to the pandemic. And that includes health equity challenges for seniors and for other persons, including First Nations, Inuit, and Métis peoples, and women who are particularly impacted, particularly low wage, often racialized populations. But the health system itself and the access to the health system is a challenge for a number of people. The long-term care facility impacts were really the feature of the first wave. And so absolutely everything needs to be done to improve capacity in that sector. From the public health system side, we do have to, I think, do everything we can to improve the capacity of the public health system. Public health is very invisible when there isn't a pandemic, and it represents a much smaller proportion of healthcare spending in the provinces, municipal level. That means that it's actually quite a small system that's trying to do many things, including preventing the acute care system from being severely impacted by the pandemic. So I would certainly advocate going forwards not to forget, the lessons learned from this pandemic, and that we need to keep the public health system going at all levels. This is not just at the federal level, but really all the way at the local level is where things happen, and long-term care for sure needs to be better supported.
Merci,
Oui,
monsieur.
merci beaucoup.
And I apologize.
Thank you, Mr. Samaris.
In the list. So we'll go back to Ms. Sadu, and Ms. Sadu, please go ahead, 5 minutes.
Thank you, Mr. Chair. Thank you, Minister, and Dr. Tam for being here today. I'm grateful to all other witnesses for appearing as well. All of you, along with the public service, have been working tirelessly since the beginning of the pandemic to keep us safe. Thank you. Minister, we have spoken several times about how the pandemic is affecting my constituents in Brampton and Peel region. You were there as well. While I know that the government provided support to Ontario, including sending in the Canadians Armed Forces and providing other resources, what is the current status to support being provided to Ontario when Peel is in the red zone?
Thank you so much through the chair and to the member for hosting me in Peel and Brampton. It feels like a lifetime ago, but just a couple months ago. And in fact, it was lovely to meet the Chief Medical Officer of Health of that region, Dr. Lowe, who's working so hard to protect the residents of Peel. Of course, we're there for Peel region, and we've been working very closely with Peel region to support and augment the response to the pandemic and the growth of cases in Peel, including supporting the ability to have a safe isolation center, something that Dr. Lowe said would be particularly useful. In fact, this will be, I think, an important addition to that region, which features oftentimes large multi-generational families, really crowded housing conditions. And we know that one of the primary routes of infection is two other family members. And so this self-isolation center that the region will facilitate and that the federal government will fund will actually provide an opportunity for people who have been diagnosed with COVID-19 and or their close contacts to remove themselves from the family household and thereby reduce the spread. We are also there for Peel region supplying additional contact tracers, and we'll be there for them as well with additional capacities as required, and we continue those conversations.
Thank you, Minister. I know the provinces and territories, in this case, the province of Ontario, provide long-term care. But given what we have seen in care homes across the country, there's a need to implement national standard for seniors care to avoid another tragedy in the second wave. Can you please tell the committee what work is happening to support our seniors in long-term care?
Thank you very much. Again, through the chair, this is a tragedy that has happened through the first wave. Of course, we're seeing infections rise in long-term care homes during this wave, and that's why we're all working so hard to protect the seniors and the vulnerable people in our communities. And it's also why during the Safe Restart Agreement, we contributed $740 million to provinces and territories to augment their infectious prevention control measures. We know that many of the homes had additional needs to strengthen those protections and keep COVID-19 out of those facilities. As you know, there were a number of other economic measures during the first wave, including wage subsidies, for example, to the most hard-hit frontline workers that included home health care workers through the provinces. And again, through the speech from the throne, made a commitment, as you know, to create national long-term care standards that I think will be a legacy of this government, in the years to come. I think no matter where a person lives, they deserve the right to age in dignity and safety. And I think all provinces and territories agree. And I think creating national long-term care standards together will be an important way that we can protect seniors in the years to come.
Thank you. Other question is, we know that testing is a very important part of stopping the spread of COVID-19, and the Canadians need across the testing regardless where they live. Can you expand on what the federal government is doing to help provinces and territory increase their testing capacity, as this is so necessary in the outbreak areas such as in my area, like particularly Brampton?
Absolutely, and thank you again for the question. In fact, over 10.6 million Canadians have been tested for COVID-19 to date, and as you know, a large portion of the Safe Restart Agreement was to help provinces and territories build their capacity to test Canadians. Testing is one component of a strategy. As you know, test, contact trace, and isolate is the way that we reduce the cases across the country. People obviously have to take actions themselves to reduce their mobility, but we know that this robust test, trace, isolate strategy is one of the ways that we can actually reduce the growth of cases as well. And in addition to the Safe Restart Agreement, we've also been procuring and sending rapid tests to provinces and territories. In fact, over 4.6 million rapid tests have been distributed to provinces and territories to date. 2 million to Ontario alone since the early October. And in fact, we've had rapid tests in the field in rural and remote communities for a very long time, supporting those communities to get access to test results very quickly. I'm thinking of Indigenous communities, for example, in Ontario that have very vulnerable healthcare systems. So we've been there for provinces and territories. And the good news is we're starting to see testing numbers go up across the country as provinces and territories build their capacity to have a robust testing strategy.
Thank you, Ms. Sadhu. We go now back to the regular list. Mr. Davies, please go ahead, 2 minutes and a half.
Thank you, Mr. Stewart. I understood you to say that of all the contracts we've signed and the hundreds of millions of doses of vaccine that we may have procured, that we will expect to receive only 6 million doses by March 31. Am I understanding that correct?
All of the vaccines that are being used for COVID are novel. They're invented for the first time for this purpose. And so the manufacturers are having to not only develop the vaccines and then do the clinical trials, they also have to scale up the manufacture of the vaccines. And so they start slowly and then they build. And all countries are interested in the very first vaccines, and the companies are trying to distribute out to multiple countries at the same time. So the amounts start out small and then they build over the course of the coming year.
Well, thank you. That's the explanation for it. But I still want to confirm this, that if we have vaccines that are approved by Health Canada, the maximum number of vaccines that will be available to Canadians by March 31 will be 6 million. Is that what you're saying?
Yes, sir. Yeah.
If I could add to that, my understanding is that of those two vaccine manufacturers, there's nothing to say that there might be additional vaccines coming. Is that correct? I shouldn't be questioning you, Ian, but
sorry,
certainly just for clarity.
I have 2.5 minutes, so if I may, my second question is to you, Minister. Minister, we had, I think, sobering numbers that came out today. We have huge COVID spikes in Manitoba, Alberta, Saskatchewan. There's alarming spikes in Ontario, BC, and Quebec. The transmission rate has been consistently over 1 since August. The national positivity rate is over 6%. Hospitalization rates are climbing across the country. We have a near crisis in Manitoba. We have the current projections put us over 20,000 cases per day by January, and we have outbreaks, alarming outbreaks in long-term care homes and Indigenous communities. Minister, I remember in the summer we had the curve was being flattened, and Dr. Tam was talking about that. Clearly, we have had an incredible flare-up. What do you attribute that to? Why is Canada at this point in November in such a dire situation? What has caused that?
Well, I think actually I'll give some overarching statements, but Dr. Tam would be best to respond. The simple answer is mobility. And as people move around, of course, the more people move around and the more people resume their everyday lives, the more we have the risk of either contracting or passing on COVID, and especially in communities where there is transmission at the community level. But Dr. Tam, perhaps you'd like to say a bit more.
Yes, so Canada, as a country and everyone working together, did well to flatten the first wave. So what happened was over the summer, of course, public health measures were relaxed. There was increased mixing of the population. And then, as the fall and winter season approached, we began to see an increase in numbers. And so a lot of it was in young adults, so in a different population to the first wave. So a really key challenge was one of looking at human behavior. For one, of course, the young adults are going to work, and it's not because they were trying at being irresponsible necessarily. They are mixing more. But there were also some social gatherings which were driving the cases as reported by colleagues in the province and territory. So a lot of it could not be necessarily managed within a workplace or a long-term care facility. There were actual social gatherings, which included some important cultural events like weddings, funerals, and other things. So that, I think, was the, what resulted in an acceleration in the younger population, which then spilled over into the higher risk populations. I think some of the jurisdictions you're seeing, like Manitoba, hardly had a first wave. So I think in some ways, people didn't quite believe that this was perhaps going to happen, and fatigue set in. And so it was really difficult, I think, to get that kind of momentum going again. But I think there's a multiple different factors. But the long drawn out nature of the pandemic in areas that haven't experienced it is definitely challenging on the ground.
Thank you, Mr. Davies. We start our third round now with Mr. McGuire. Mr. McGuire, please go ahead. You have 5 minutes. Mr. McGuire, you're muted. We'll start you over. 5 minutes.
We'll get there. Thank you, Mr. Chair. My apologies. Just want to go back to the previous question of Mr. Barlow there and see if we could get the table with the committee, the service standards that were referenced in the interim order. That's the ones for the Health Canada approval.
Mr. Chair, those service standards are available on the web, and we'd be more than pleased to provide that information to the committee through you.
Thank you. I just wanted to also ask Deputy Minister Lucas, yesterday in Parliament, one of the Liberal MPs, McConnell, thanked the Prime Minister for committing to long-term, the national standards for long-term care. We don't know anything about that because to date, there's been no information other than a line in the throne speech. So what we do know, though, is that 80% of the COVID deaths that have been related to long-term term care homes. So, kind of succinctly, has your department advised the government to develop national standards for managing the long-term care homes during these pandemics?
Mr. Chair, what I would indicate is that the government has committed to working with provinces and territories to develop long-term care standards. There are existing standards, and I think the intent is to work with provinces and territories to look to where these can be strengthened.
Excuse me, Mr. Chair, could the deputy just table those then with the committee, please?
If I could answer that question, Mr. Chair, that's okay.
Let's go ahead.
I'll just say that the development of long-term care standards would be done in partnership with provinces and territories. This is not something that the Government of Canada would impose on provinces and territories, but rather work to co-develop.
Well, and Mr. Chair, has the minister advised her officials to begin drafting national guidelines for managing long-term care facilities during this pandemic?
Mr. Chair, reviews have been ongoing about how to strengthen protections in long-term care homes for seniors living in those residences, and that work began far in advance of even talking about a national set of long-term care standards, as we worked to understand how to better protect long-term care homes in provinces and territories, including by providing the money for stronger infectious disease protocols.
So to the Deputy Minister then, has either the department or has your department provided any information to provincial governments on what the federal government's national standards would entail?
As Minister Hajdu, Mr. Chair, as Minister Hajdu indicated, the government has clearly signaled to that this work will be done in collaboration with the provinces. As Minister Hajdu noted, there was extensive work done to develop infection and prevention and control guidelines for long-term care facilities. That was done through experts and with a special advisory committee that Dr. Tam chairs, and that was provided to the provinces and territories and posted publicly in the spring.
So to the deputy then as well, COVID shone a light on this, on how ill-prepared the long-term care facilities have been in dealing with the pandemic. We've got people, 4 persons in a room, multiple seniors needing shares of washrooms, that sort of thing. Need to modernize the long-term care facilities while protecting them from the outbreaks. And so have you given any advice to the government to suggest that changing federal infrastructure and COVID programs to allow long-term care facilities to apply for these funds could have positive public health outcomes? And if you have, I wonder if you could just table that for the committee.
I will respond, and then Mr. Chair would propose to turn to Minister Hajdu as well. But what I would indicate in the Safe Restart Agreement as part of that contribution provided to the provinces, one of the areas targeted long-term care and support for vulnerable populations. The government invested $740 million, and that included an ability to address a number of the challenges faced in long-term care, from infection prevention control to the physical setup of those facilities. And that was an investment focused to enable stronger protection for the residents. With that, Mr. Chair, I'd like to turn to Minister Hajdu.
Thank you, Mr. Chair. We also, just to finish the answer, because I think it's important, we also have revised some of the infrastructure spending, as you know, to create the COVID resiliency stream, which allows for provinces, territories, municipalities to actually apply to use money to strengthen long-term care homes or to do renovations in those homes.
Thank you, Mr. McGuire. We go now to Mr. Van Bynen. Mr. Van Bynen, please go ahead, 5 minutes.
Thank you, Mr. Chair, and thank you for joining us again today, Minister. It's been a very busy time for you and the health officials that are here today, particularly Dr. Tam. I really appreciate you virtually stopping by York Region recently and for joining us the second time here in committee. I'm thrilled to have this opportunity to ask you the questions that I consider to be important to my constituents. Minister, we're all aware of the heavy toll that COVID-19 pandemic has had on Canadians, and especially on their mental health. I'm seriously concerned about this, which is why I introduced a motion for us to study the impacts of COVID-19 on mental health of Canadians. These are uncertain times, and there's no doubt that many Canadians are facing new and increased concerns with their mental health. Could you please explain to the committee what your department is doing to help Canadians access mental health services?
Well, thank you so much through the chair, and thank you for the focus to the member on mental health and people who use substances. You know, we know that this pandemic is creating a high degree of anxiety, of loneliness, of stress, of grief, actually, for Canadians as they work through the many aspects of living through a pandemic. And in fact, early on, drawing from experiences of countries that were ahead of us, we knew that we needed to rapidly act to put together supports for Canadians, no matter where they lived, no matter what supports they already had in place, because of course, so many Canadians don't have access to mental health services or substance use services where they live. And that's why this spring we launched the Wellness Together portal. It's completely free, it's completely confidential, it's available in both official languages. In fact, there's translation for folks that don't speak either official language. And as of November 17th, more than 613,000 Canadians across the country have used this portal with over 1.7 million distinct web sessions. The neat thing about the portal is it actually connects people to professionals, as well as providing some, self-assessments and self-help tools. But people can actually get help from professionals through texting, through telephone, through virtual visits. And I know there's more to do, but this was certainly something that I think can help support people, especially folks that don't have access or trusted providers in other parts of their life.
Thank you, Minister. There's no doubt that COVID-19 has changed our lives. It's increasingly apparent that some groups are feeling mental health impacts of COVID-19 much harder than others. There's also an increased awareness of the need to address inequities amongst Canadians. And it's my understanding that you've announced a fund specific to addressing mental health amongst Black Canadians and other racialized groups. Could you please elaborate on that?
You're absolutely, Mr. Chair, through the chair, the member's absolutely right. The impact of the pandemic, although we're all in it together, has different factors for different groups. And one of the things that we have seen, of course, is the experience of anti-Black racism that many people from the community have spoken about, not just during the context of the pandemic, clearly, but as part of their everyday experience. And that groups that are racialized, that are stigmatized as a result of their backgrounds and their experiences, it really is, it is a public health threat. And that's why we're investing $10 million through the Mental Health of Black Canadians Fund. This project, this funding will support 16 community-based projects across the country, doing very important work to support Black Canadians in these challenging times. We've also extended applications specifically for projects to support Black LGBTQ2+ Canadians. Another gap, by the way, that's very specific and very unique. Again, this is really about supporting organizations and community projects that are run by Black Canadians for Black Canadians, and of course have the opportunity to help support people who are struggling in this particular time.
Thank you. Minister, earlier on during these studies, we'd learned a lot about how the pandemic has shone light on the challenges in our healthcare system. And in particularly, we heard a lot about the information gaps and the data infrastructure challenges across Canada's health systems and how that limits our ability to monitor and to respond to COVID-19. I know that Health Canada has received $303.4 million of the Safe Restart agreements funding. So could you provide us with details on how this funding would help modernize and improve our public health and health information systems and close the gaps to help us fight this pandemic?
Thanks through the chair to the member for the question. No doubt about it, data has been a challenge during this pandemic. Obviously, provinces and territories have vastly different data systems and different ways of collecting data, different kinds of characteristics that they collect, huge gaps in, for example, racialized data and knowing exactly how the pandemic is affecting racialized groups depending on the province, territory, even sometimes local jurisdictions. And that has has made it challenging at the federal level to truly have a concrete picture. And in fact, part of the Safe Restart Agreement, over $5 billion was for testing, contact tracing, and data systems that can give all levels of government a more granular understanding of how the pandemic is affecting the various groups that we have responsibility to deliver services to. I will just say that the Public Health Agency of Canada is working very closely with the provinces and territories now to get data on patients' ethnicity, to build out that data set, because we know from other jurisdictions and even from the limited data that we have that oftentimes various groups, racialized groups, are experiencing COVID-19 in worse ways than other folks.
Thank you, Mr. Van Bynen.
Thank you.
We go now to Ms. Rempel-Garner. Ms. Rempel-Garner, 5 minutes, please.
Thank you, Chair. Just the statement that the minister just made, data has been a problem, especially at the federal level. I guess just to Mr. Lucas or Mr. Stewart, has your departments given the government any advice to use various legislative mechanisms? I know that there are some available under this, for example, the Statistics Canada Act, to compel the provinces to provide data to the federal government in a more meaningful way as it comes to collecting information on how COVID is being transmitted and the efficacy of various interventions with regard to preventing the spread.
Mr. Chair, I'd like to turn to Les Linklater to speak to the work with the provinces on data.
Thank you for the question, Mr. Chair. We have been taking a very collaborative approach with provinces and territories around the collection and aggregation of data across the country, particularly as it relates to COVID-19, through the Special Advisory Committee that's been referenced earlier that comprises public health officials from across the country.
Thank you, Mr. Linklater. That wasn't the question I asked. I've got a very short period of time. So I'll take that as no, that there's been no advice to the government on using any sort of legislative mechanism to actually get that information in a federal repository. Is that correct?
The focus has been working collaboratively with provinces and territories.
So this morning, the Prime Minister suggested that businesses were better off because of lockdowns. And as a legislator, I've been trying to figure out, especially given the amount in these estimates, trying to figure out if the measures that have been put in place are actually working, especially given the projections on new caseloads. So I'm just wondering if you could point me to any publicly available federal data that's been used, I guess this would be Mr. Linklater, to suggest that repetitive COVID lockdown has better impact on Canadian society than the negative societal impact of, let's say, job losses, mental health, as was just discussed, being separated from family. I'm just trying to look at, that's a big statement that was made this morning. So is there a publicly available repository of federal data, federally collected data, that I could use as a legislator to evaluate that statement?
Mr. Chair, if I might start, in fact—
No, you might not start, Minister. I asked the question to Mr.
Chair for permission to start.
But you're a witness, Minister, so it's my time.
Thank you. Ms. Rempel-Garner, I'd like the Minister to respond.
Point of order, Chair. Point of order, Chair. Point of order, Chair. I understand
I'm responding.
Point of order, Chair.
I hear your point of order. I will take up your point of order in due course. It is appropriate for us to treat the witnesses with respect and courtesy, and I believe if the minister wishes to answer questions that is put to her officials, I think she's entitled to do so.
You're not doing that with Mr. Linklater.
Point of order, Chair.
Go ahead with your point of order.
Point of order, Chair. This is my time to question witnesses, and quite frankly, to suggest that it is not respectful for me to be asking for information on how data is being used and collected on interventions that are costing millions of jobs and thousands of lives is frankly, as a woman, I find it kind of sexist, because that's always what you say to me is, oh, it's being disrespectful. These are tough questions, and I get to ask them to who I want to ask them to. It is my job as a parliamentarian, and I'm tired of this. I understand that the minister might not like the question, but it is me who gets the floor. Am I clear?
Ms. Rempel-Garner, it is
my point of order, Mr. Chair.
Hold up. I did not say you were disrespectful for asking the question. I just said that it's appropriate for the witnesses to have time to answer the questions that are asked.
The minister was the one who interrupted
Don't interrupt me, please.
The minister interrupted
Do not
me.
interrupt me, please. It is with responsibility. The minister is responsible for her officials. If she wishes to answer on their behalf, I'm perfectly ready, willing, and able to accept that.
Point
Mr.
of
Van
order,
Bynen, you have a
Chair.
point of order. Mr. Van Bynen,
I am not done with my
yeah.
point of order, Chair. I am not done with
Mr.
my
Van
point of
Bynen
order.
is
You have not
responding.
ruled on my point of order.
Point of order, Mr. Chair.
Mr. Van Bynen has a point of order on Ms. Vempel-Garner's point of
Mr.
order.
Chair,
Mr. Van Bynen, go ahead.
My request, Mr. Chair, was that my understanding is that it's the chair who recognizes who has the floor. And in this case, that you did direct that question to the minister. Totally appropriate.
Thank you, Mr. Van Bynen. Ms. Sadhu, you have a point of order on the same point of order?
Mr. Chair, as a woman, let's be respectful to each other and ministers here, and then let's ask everyone's question and let's go back to work. Thank you.
Thank you, Ms.
On
Van
that point
Bynen.
of
Ms.
order.
Vempel-Garner, you have a further.
Thank you. To Mr. Van Bynen's point, it is me who directs the questions, and I understand that the minister might want to answer, but she is here in her capacity as minister, and I am directing my questions as a parliamentarian. It is my job right now to be scrutinizing the estimates, which is about $1 billion, on behalf of my constituents. I did the preparatory work, and I get to ask who I want. This is not the minister's show to control. I am asking the person who is in charge of data questions about data, and I would like the answer from him. If the minister would like to go and do a show at Rideau Cottage tomorrow with the Prime Minister, she is welcome to do that. In the meantime, I would like to get my question answered from Mr. Linklater.
Mr. Chair, in the interest of time, why don't we just have Mr. Linklater answer the question?
Very well. Thank you, Minister. Go ahead, Mr. Linklater.
Thank you, Mr. Chair. As I understand, the question is the use of data for the development of broader relief programs. And of course, relief programming is beyond the ambit of the Department of Health. Many departments, including the Department of Finance and others, would be intimately involved in developing those types of programs based on various data sets.
So I guess what I'm asking is, ostensibly we're managing to preventing the spread of COVID, but we've seen the number of COVID cases rise. So what data would parliamentarians be using right now at the federal levels on if interventions that are being suggested, including economic lockdown, have a greater impact on the health of Canadians, or are the downside of it? It's actually having a negative impact on things like mental health, that job losses. Like what is Health Canada? Have you provided any recommendations to Health Canada or to the government to perhaps put together a better data repository that we could use to evaluate those particular questions? Because I think they're top of mind to many Canadians.
Mr. Chair, again, thank you for the question. As I mentioned earlier, the common data set that's been agreed by public health officials has been one of the key developments in trying to bring a more holistic public health data lens to COVID. I would perhaps suggest Dr. Tam would like to add on this point, given her exposure to this and as a clinician.
Yeah, so the measures in terms of restrictive public health measures is done by the province or the local health units and using their data. So they will have flexibility on that. We do not suggest one way or another which kind of business or measures should be enacted. So provinces have been providing us with their case data and this new national data set with a bit more information, including race-based data. But
just a question. I have 30 seconds left, and I just wanted to clarify on this. Like, for example, I know we don't have occupational health data from certain provinces and whatnot. So there has been no effort to date to recommend to the government a more fulsome federal data gathering system from the provinces on, let's say, the efficacy of lockdown.
There has been this investment that people has already been in mentioned, but this is to develop a national health data strategy. So that is
when will that be done? When will that be done?
Thank you, Ms. Vempel-Garner. Your time is up. We go now to Mr. Kelleray. Mr. Kelleray, please go ahead. 5 minutes.
Thank you, Mr. Chair, and thank you, Minister and staff, once again. One of the groups I'm especially concerned about with regard to the mental health of seniors, and I want to thank MP Van Buyden for his work and leadership on that file as well. You know, whether it's seniors living in care facilities or in their homes like my mom, we know that the toll of the lockdown and isolation is exceptionally heavy for seniors. In my community, I've heard from my constituents that seniors need more ways to socialize and not less during these times. So can you tell the committee and those following along at home what our government has been doing to provide supports for mental health of seniors across this country?
Thank you, Mr. Chair, and thank you to the member for advocating for the mental health of seniors. And you're absolutely right. I think it's the thing that many Canadians worry about the most is the mental health of the seniors that for their own protection are isolated. Certainly, I think we can all think of someone in our lives that is alone and that needs us more than ever, ironically, as we are being told to stay apart. That is why we launched the Wellness Together Canada portal to provide confidential support. I've spoken extensively about that. It's certainly available for seniors, but I think the additional investments in the New Horizons for Seniors program is also, I think, worthy of talking about. This additional $20 million is to support these community-based projects, and most of us know these programs in our riding. They're small programs, but they're mighty programs. But oftentimes they are, you know, building programs that are face-to-face in communities, and this additional investment is allowing for many of these different kinds of organizations, oftentimes not-for-profit organizations, to help find new ways to keep seniors connected in their communities. You know, some of the innovation that you can imagine is connecting seniors, for example, with young people digitally, making sure that seniors have the ability to have the tools they need in place to communicate via FaceTime, for example. These are, in some cases, new tools for seniors, not always, but certainly I think I want to thank and commend those not-for-profit organizations for thinking outside the box all across the country and doing that incredibly hard work to keep people buoyed and comforted during this time.
Thank you, Minister. And I would echo that last comment on not-for-profits across this country. Amazing leadership on the ground at the grassroots, and it's what's needed. And we know we'll get more of that as we go through this terrible pandemic. One last question. The government launched a national exposure notification app. My home province of Nova Scotia has joined the platform as well as the rest of the Atlantic bubble. And I personally downloaded the app and am encouraging my constituents to download the app as well. A lot of people, Minister, have questions around some of the language, though, used to explain how the app works. So could you explain for Canadians the difference between exposure notification and contact tracing? And I guess the last question would be, why did you choose this model, or why did the department and yourself choose this model? Thank you.
Well, thank you very much. The COVID Alert app is a really important tool for Canadians and, in fact, for public health officials to help alleviate the burden on public health to do that contact tracing. The difference between a notification and contact tracing is one happens through the app, very confidential, by the way. You get a notification on your phone that says you've had a close contact with someone who's tested positive. It doesn't identify their name or where even that contact might have happened, but it gives you an indication that you should reach out to public health, perhaps to get tested, to get advice about what to do next. The contact tracing is a much more intensive process that public health officials undertake when there is a positive case. They're going through with the person, who have they been around, where have they gone? Oftentimes it's hard for a person to remember. Sometimes there's issues of privacy, and it can be very labor intensive. So this alert app actually provides that rapid, private way for people to know if they've been in close contact with someone who's positive. It uses Bluetooth technology. It doesn't record users' location or other personal information. Obviously, this was really important to Canadians that we first and foremost protect their privacy. It's actually more private than Instagram and Facebook apps that are often on people's phones. And so it's really important that people download the app. And I just like to put a plug out right now to any Canadian who might be listening to us that they download the COVID Alert app. As the Prime Minister said this morning, in fact, even if you're in a province where the COVID alert app is not functional, it's wise to download it, because if you do come into contact with someone from another province that is using the app, then and they put in the code that they've been tested positive, you'll still get a notification, even if you're in a province that doesn't currently utilize the app. And you know, we've got almost all the provinces on board. It's really, really important tool to help alleviate that burden on our hardworking public health staff at the front line.
Thank you, Mr. Kilroy.
Thank you. Thank you very much.
Nous allons maintenant à Monsieur Samri. Monsieur Samri.
Mr. Samri, after to you. You have 2.5 minutes. Thank you very much. And I'd like to congratulate you, Chair, on your French. First of all, back to the rules. A few minutes ago, there were several committee members who were speaking at the same time, making points of order. I'd like to remind the members of the committee that it makes the interpretation very difficult when several people are speaking at the same time. So with hybrid sessions, I would like to remind the members of the committee or I would ask them to try not to intervene all at the same times, even if they want to do so, out of respect for our interpreters who are doing a remarkable job and who I would like to pay tribute to. So this completes my point of order. Mr. McKinnon, my question is for the minister. Given the responses given by Dr. Tam and the minister herself, to my mind, I note that the public health system was fragile before the pandemic, and this was as a result of underfinancing. When we look at what the people in charge of the parliamentary budget are, we see that this underfunding is largely explained by the shifting responsibility from the federal government. If I read an excerpt, he says that by indexing federal health care funding to the GDP growth, the federal government was taking advantage of the financial impact of the aging of the population. But the provincial governments, do they have the constitutional responsibility for health, and they can't act in the same way? So, Chair, the minister has said to us that there's going to be a meeting of the premiers in early December where this matter could be discussed. The Minister of Finance has also told us that there's going to be an economic update shortly. Can the minister tell us whether the requests made by the provinces in the speech from the throat, could they be responded to in part here? In other words, providing better health funding on a stable basis, not just for the pandemic. I do recognize the work that the minister is doing during the pandemic, but I'm talking about on a longer term basis. Can we expect some good news in early December, even if we don't know exactly what the date will be?
Thank you very much. And through the chair, I admire the members' persistence, but I don't have the, listen, those conversations will happen. The Prime Minister has made a commitment to meet with the provinces and territories to talk about long-term healthcare funding. I think that demonstrates openness to understanding that we all need robust healthcare systems in all provinces and territories. I agree with his statement that oftentimes it's hard for provinces and territories and indeed local governments to see the value of prevention and investing in local public health. I think Dr. Tam has said that, but I do know that the commitment of the Prime Minister is to meet with the provinces and territories in December to talk about healthcare transfers.
Merci beaucoup.
Thank you very much.
Si je croyais que mon temps était terminé, mais
I believe that my time was up, but if it isn't, the minister talked about her interest in having a drug insurance program. I would like to ask whether the government is moving forward on this subject, and if so, whether Quebec is going to be able to withdraw with full compensation.
Thank you again for the question. And I think hopefully you can tell by the nature of our work through the pandemic that we believe that everything we do has to be done in partnership and with respect for provinces and territories. That's how we've managed the pandemic together. That's certainly how we've managed to order our affairs in terms of, for example, testing, contact tracing, data gathering. We just had a round of conversations about mandatory data gathering. As you know, this government believes that provinces and territories have the responsibility to deliver healthcare systems in their jurisdiction, and we have the responsibility to support them in that work. And so the work that I'm doing on a national pharmacare program will be in partnership, full partnership with provinces and territories.
Merci, monsieur.
Merci beaucoup.
We go.
Thank you very much.
Mr. Davies, go ahead. You have 2.5 minutes.
Minister, you just referred to national pharmacare. Are you committed to delivering national pharmacare through our public system?
Thank you for the question. And in fact, it's this government that's done more to lower drug costs in a generation. Listen, we've been very clear. We believe that no Canadian should have to choose between putting food on the table and purchasing pharmaceutical drugs that they need to stay healthy or to address their illness. And let's be clear, we have been taking strong steps towards a national universal pharmacare program, and we'll continue that work. Budget 2019 committed money towards the development of a Canada Drug Agency, and the work is ongoing right now to stand that agency up.
Thank you. Mr. Stewart, I just want to be clear on this. The 6 million doses of vaccine that we're going to have delivered by March, hopefully, is from Pfizer and Moderna. Is that correct?
Yes.
So when the Prime Minister says that he negotiated 20 million doses of vaccine from Pfizer,
yes,
that means that at least 16 million of those doses are going to come after March 31st. Is that correct?
Yes.
Can you tell us how many doses of vaccine Canada has procured in the second quarter of 2021?
I don't have that information off the top of my head. We have 7 procurement agreements now, and those add up, and the Prime Minister and others have made those numbers available to a substantial number of vaccine doses. I don't have them in front of me broken out by quarter.
Okay, well, many people have expressed concern that, I mean, it's one thing to say we've negotiated contracts with 400 million doses, but that's meaningless if we don't get those doses for 8 months or 12 months or 18 months. Can you tell us how many doses Canadians can expect a vaccine to receive in 2021?
My understanding is based on the agreements that we've negotiated and on the assumption that they are approved by the regulator, which is a big if. And if they deliver them on time, which my statement earlier is in fact a big if as well, that there will be sufficient vaccine doses delivered to achieve a population immunity threshold over the course of the next year. And that's my understanding. But
the first 3 months, the first 3 months is less than 8%. If we require 2 doses per vaccine, 6 million doses, that's enough to inoculate 3 million Canadians by March 31st, which is about 8% of our population. Is that correct?
Yes, that sounds correct. Yeah.
If I could squeeze one more question in.
Mr. Davies, you're over. We have 16 minutes left on my account. We don't have time for another round. I would suggest perhaps if the committee would agree to it, a lightning round of say 2 minutes per party. Would that be acceptable to the committee?
Could that be 4 minutes per party?
We don't have that much time.
I thought you said 16 minutes.
Well, we also do have a vote to undertake to vote on the estimates.
Okay, thank you.
Okay. Thank you. So assuming that's correct, I see no dissent. We will turn it over to the Conservatives for 2 minutes, if you please. I don't know who wishes to speak on behalf of the Conservatives.
Mr. Barlow.
Mr. Barlow, please go ahead.
Thank you very much, Mr. Chair. And just want to go back quickly to a question I asked earlier to Mr. Lucas. When will an at-home test be in the approval process?
Mr. Chair, I cannot speak to that question specifically because it depends on the manufacturer submitting an application to Health Canada. As I indicated, we actively engage manufacturers in Canada and globally in terms of encouraging them to submit to Health Canada. And when they do, we review it expeditiously in the context of our service standards and interim order.
Okay, to Dr. Tam, just talking about some of the delays with testing. My wife went and got tested the other day, and she was surprised when she saw so many people stay in the lineup and then leaving. This is about contact tracing and the delays in that system. When do you think Health Canada will have an approval for an at-home test, so we don't have to deal with lineups and the stigma around COVID testing?
I can't speak for the regulator. That the Deputy Lucas has already addressed that point. But we have provided a lot of tests to provinces and territories, so we would like to see how we can support them from increasing access.
Well, it's maybe to Dr. Tam or Mr. Lucas then, seeing in the estimates, the government has spent, more than $10 million on promoting the contact tracing app. But does it not defeat the purpose if you have to wait a couple of days to get a test and then a few days after for the results? Is the app actually doing the job it's intended if there are delays in testing and then delays in results?
Ms. Teresa Tam, Chair, I'll take that question. Absolutely, you have to have a rapid turnaround in order for contact tracing to be done rapidly, and that is done by the local jurisdiction. And so while we provide the tests, we've been supporting that. We've been supporting surge capacity, and we've been supporting surge through Red Cross and others to help speed up that testing critical path. But you're correct. The faster you get the test turnaround, and that's done in the provincial jurisdiction, the better. But we have now pushed out a lot of rapid tests that should have more like a 15, 30-minute turnaround depending on the test itself.
Thank you, Mr. Barlow.
Thank you, Mr.
Go now to Ms. Sidhu. Ms. Sidhu, you have 2 minutes.
Thank you, Chair. Minister, Brampton is a home for many essential workers, 11,000 truckers call Brampton home, who have to travel the country and cross the border. So 8,000 food processing workers who keep the grocery stores full. Although it has definitely slowed down, Pearson Airport is one of the most important employers in the area. These workers simply do not have the option of doing their job from home. Can you please talk to us about whatever government is doing to provide additional needed support to these workers' essential services?
Well, thank you very much, and for the question. And as we know, focusing on essential workers has been a critical aspect of our work as a government, and whether it's to support people who lost their jobs temporarily through the first wave, or who may, be subject to a variety of different restrictions as a result of public health measures, through the CERB, through the wage subsidy. Those are the kinds of things that we've been doing to support workers all along. In terms of essential workers, I think the work that we've done to really control the traffic flow of non-essential travel across the American border while making sure that essential workers were able to continue to cross that border has been incredibly helpful to truckers. In particular, you mentioned truckers. I know that there was a high degree of worry at the beginning when we were negotiating those border closures with the Americans that we could not do anything that would stop the essential flow of workers, of transportation, of trade that is so essential to the functioning of our country, and of course essential to the jobs and livelihoods of truckers. And I want to thank my colleagues who have done that difficult work with our American partners. In fact, reduce the amount of travel across the border while maintaining our ability to have free-flowing transportation for essential workers like truckers and the goods that they deliver.
Thank you, Ms. Sidhu. We go now to Monsieur Samori, s'il vous plaît, 2 minutes.
Oui, merci, Monsieur le Président.
Thank you, Chair. My question will be for Dr. Tam or someone from her team. It's related to the modeling that she discussed today, which is of great concern. We're talking about potential 20,000 cases per day by the end of the year, according to the mathematical modeling. I would like to know whether this model is based on the situation that most countries in Europe have been experiencing, in Western Europe, who seem to be ahead of us in terms of what we're experiencing here. And if not, in terms of the social contact parameters, whether she could please, whether we could see the highlights in terms of what limits contagion. Is it at schools? Is it at workplaces? Is it social gatherings outside of those areas? Where is there a difference that we can make? Thank you.
Thank you. And I am not a mathematical modeler. The model methodology we can provide is actually, there's a link on our website, and it's from the Simon Fraser University. But the modelers can put through many, many different scenarios to give projections. What I can provide, though, is more on the epidemiology front and what is being reported by local public health. And so there are a number of really key take homes. One is that even at the national level, we can see that at least 30%, and in some cases more, of the cases are unlinked, which means they're community transmission, whether they haven't linked back to a particular site. That's very concerning because that traceback mechanism is really important. For the rest, the long-term care facility outbreaks are currently escalating, so have to do more on that front. There are school outbreaks, quite a number of them, but many of them are small numbers, and they're based on community bringing, sort of community transmission, not necessarily in-school transmission. So they need to be handled differently as well. And there are a number of quite large outbreaks related to certain work settings. We've heard about the meat packing area, where there's a lot of measures that have to be put in place in order to sustain that essential service, and some in the food and retail area. But it's actually, the reporting is in a way biased towards long-term care and schools or workplaces where there's a defined population. You can find them. Where it's difficult is outside of that, where people are not linking back. So it's up to the local jurisdiction who's currently has to put in these restrictive measures because they've lost the ability to link. But a lot of it is also due to social situations where, private gatherings, as I've mentioned, whether they be weddings, unfortunately funerals, and other celebrations.
Merci, monsieur. We go now to Mr. Davies. Mr. Davies, please go ahead. 2 minutes.
Thank you, Minister. I know you've been preoccupied with the COVID pandemic, but of course we have a raging opioid overdose crisis in this country at the same time. And I know here in Vancouver and British Columbia, we're on track to have the worst record in history of number of people dying from overdoses. This week, Vancouver Mayor Kennedy Stewart unveiled his plan to implement a fully health-focused approach to substance use by decriminalizing simple possession of all drugs through a federal health exemption. And I note this plan is backed by BC Premier John Horgan, Provincial Health Officer Dr. Bonnie Henry, Vancouver Coastal Health Chief Medical Health Officer Dr. Patricia Daly, and even the Vancouver Police Department itself. Minister, will you grant this health exemption requested by Mayor Stewart in light of this comprehensive support for this approach here in the city of Vancouver?
Well, thank you very much, Mr. Chair. And the member is quite right. The opioid crisis has been growing over the years. We were starting to see some relief over the last several years as a result of the work that our government has been doing to restore harm reduction, to invest in emergency responses, to provide opportunities for safer supply and for prescription use of opioids that can reduce access to or reduce reliance on toxic drugs sources. I also have been in close contact with my colleagues in BC at the provincial level, and indeed Mayor Stewart. And I will just say this, I'm watching with interest the work that he's doing with City Council. I'll look forward to reviewing the motion when and if it passes City Council. And I have said this, I will work with provinces and territories to ensure that they have the tools that they need to combat this pandemic. Opioid pandemic, I should be clear.
Thank you. The National COVID-19 Volunteer Recruitment Campaign was launched by your government, Minister, in early April. And you called on Canadians to step up and help with the pandemic in 3 key areas: case tracking, contact tracing, surge capacity and data collection. And we had 53,000 people sign up to assist by the time the posting closed on April 24th. But it appears that the volunteer database does not appear to have been used in any province or territory. Given that Canada continues to struggle to increase our pandemic response capacity, why haven't these volunteers been put to work?
Thanks for the question, Mr. Chair. I know that some of the volunteers have indeed been utilized depending on the jurisdiction. In fact, we've shared some of the volunteers with the Canadian Red Cross who have been actively working to help with the pandemic response. I'll turn to Stephen Lucas, who knows more about the details of the volunteer program.
Thank you, Mr. Chair. I will respond in indicating further to Minister Hajdu's comment that the volunteer inventory with consent of the volunteers was provided to the Canadian Red Cross to support their recruitment in Quebec and Ontario, for example, in terms of long-term care support. And we have been in active contact through the spring and continuing with provinces and territories across the country in terms of providing them access to use and contact volunteers to support their needs.
Thank you, Mr. Davies. So that ends our several rounds of questions. And we have a number of votes on estimates to go ahead with at this point, for which we do not require the presence of the minister or the officials. So on behalf of the committee, I'd like to thank the minister and the officials for giving us so much of your time today and sharing your expertise. And I thank you for all your work on an ongoing basis. And so thank you. So we have, to the committee, we have a number of votes. I don't expect they should take a long time. So I shall call the first one right now. So shall vote 1B under Canadian Food Inspection Agency carry? I would
On
ask
division.
on division. Very well. Shall vote 5B under Canadian Food Inspection Agency carry?
On division.
On division. Everyone's agreed with that? Okay. Shall vote 1B under Institutes of Health Research Agency carry?
On division.
And I see no dissent. I'm sorry, that was vote 1B? Shall vote 5B under Institutes of Health Research Agency carry?
On division.
On division, that's agreement. Shall vote 1B under Health Canada carry?
On division.
Shall vote 5B under Health Canada carry?
On division.
Shall vote 10B under Health Canada carry?
On division.
Shall vote 1B under Public Health Agency carry?
On division.
Shall vote 5B under Public Health Agency carry?
On division.
And shall vote 10B under Public Health Agency carry?
On division.
All right, thank you, everybody. So finally, we ask that, shall I report the votes on the supplementary estimates to the House? Is there any dissent? Seeing none, I declare the vote. The matter carries on unanimous consent. So thank you, everybody, and we will see you all on Monday.
Hey, Will.